Finally, let's tackle a really important question. Are parents actually willing to pay more for dye-free products, and does their stated willingness match their actual purchasing behavior? Because there's often a gap between what people say they want and what they actually buy when they're standing in a grocery store aisle, and understanding that gap is crucial for predicting whether market forces alone can drive reformulation. Market research on this topic reveals some interesting patterns. When you survey parents and ask if they prefer products without artificial colors for their children, you get overwhelming positive responses. Typically, 70 to 80% of parents say yes, they prefer dye-free options. When you ask if they're willing to pay more for dye-free products, a majority still say yes, though the percentage drops to maybe 50 to 60% depending on how the question is framed. But here's where it gets complicated. The willingness to pay premium prices varies significantly by income and education level. Higher-income parents with college degrees are much more likely to actually pay premium prices for cleaner label products. Lower-income parents express preference for dye-free options, but are more price-constrained in their actual purchasing. This creates a market segmentation where premium products reformulate and budget products don't. Discrete choice experiments, where researchers simulate purchasing decisions with various product attributes and prices, provide more realistic data than simple surveys. These studies show that parents do value dye-free labeling, but it's one factor among many, including price, taste, brand familiarity, convenience, and their children's preferences. When price differences are small, like 5 or 10 cents per unit, most parents will choose the dye-free option. When price differences get to 20 or 30%, many parents switch back to the cheaper option despite their stated preferences. The survey results consistently show a gap between intention and behavior. Parents overestimate how much they'll prioritize dye-free options when faced with real-world constraints like screaming children in the grocery store, limited budgets, time pressure, and kids who refuse to eat things that look different than what they're used to. Purchase intent studies that just ask what people plan to buy show much stronger preference for dye-free products than actual scanner data showing what people really purchase. Real-world purchase data from regions where both artificially colored and naturally colored versions of products are available side by side reveals that price is king. The dye-free versions capture significant market share, maybe 20 to 40% depending on the category, but the cheaper artificially colored versions still dominate overall sales. This isn't because parents don't care, it's because household budget constraints are real and many families are making hard choices about where to allocate limited resources. Parent testimonials provide qualitative insights. Many parents express frustration that cleaner label products cost more, feeling like they're being penalized for trying to make healthier choices. They resent the implicit message that protecting their children's health is a luxury good available only to those who can afford premium prices. Some parents describe trying to buy dye-free but giving up when their kids refuse to eat the different-looking products. Others talk about the mental load of constantly checking labels and the guilt of sometimes choosing the convenient, cheap option instead of the healthier one. The income and education segmentation is particularly troubling from a public health equity perspective. Children from higher income, more educated families are increasingly eating products without artificial colors as their parents seek out and pay for premium options. Children from lower income families continue consuming dye-heavy products because those are what their families can afford and what's most heavily marketed in their communities. This creates a situation where health risks are being unequally distributed along socioeconomic lines. The price sensitivity data shows that relatively small price differences matter enormously. If natural colors added just 5% to product costs and manufacturers passed that through to consumers, most families would absorb it and choose the healthier option. But when price differences reach 15 or 20%, many families can't or won't pay the premium. This suggests that policies that reduce the cost difference, whether through subsidies, tax incentives for reformulation, or other mechanisms, could be more effective than hoping consumer demand alone will drive change. What this all tells us is that while consumer preference for dye-free products is real and growing, it's not sufficient by itself to transform the food system. Market forces will reformulate some products, but will leave behind a large segment of cheaper products consumed primarily by lower-income children. That's why policy interventions remain necessary. If we want all children protected, not just those whose parents can afford premium products, we need regulatory standards that apply across the board. Consumer behavior data should inform our expectations about what market-based change can achieve and where it falls short.